Hey there, welcome back. Chapter 45, AEMT book, Geriatrics. As I've said many times, including in the EMT Geriatrics, which was chapter 34, the elderly population is a huge part of our business in EMS. Doesn't matter whether you're fire-based, private, or hospital-based, right? Elderly are twice as likely to call for EMS. So it's kind of an important piece of our education. Okay, so excuse the noise in the background. I'm at work, and so that was our transfer truck signing out on a call. So U.S. population age 65 and older is certainly increasing, and it is expected to continue to increase because medicine's getting better. Health is getting better. Simply to extend life at the expense of quality of life makes no sense. No sense at all, right? To live an extra 10 years being bedridden would suck, but going around now, or the last 10 or 15 years have been that, well, 60 is the new 50 and 40 is the new 30, and it kind of is. And it kind of isn't, right? You have a lot of patients that we take care of that you look at them and like, holy cow, 85, I'd have never guessed, right? And there are others and you look at them and go, holy cow, 55, I'd have never guessed, right? So it goes both ways. So geriatrics, the study, the patients, the gerontology, how they do this, right? Don't get too hung up on those terms. But why do we see them? Regardless of how good medicine is getting and how many different medications are out there to control things, our older folks still are the ones with the majority of the cardiac disease. Folks like my mom with her emphysema, right? She earned it with every cigarette she smoked. So the older you are, the more you abuse your body with drugs, alcohol, high blood sugar, hypertension, the more medical problems you're going to have. I mean, it makes sense, regardless of how good medicine has gotten. Neurologic problems, whether it be from strokes or neuromuscular diseases, the dementias, the Parkinson's, okay, falls. As we age, we tend to get weaker and lose muscle mass. And if you're not active because of those things, then you don't always have the strength to do things that you think you should. You run into trouble on the stairs. We have problems with balance, and we turn and we lose our balance and we fall. Vision gets to be an issue, right? You don't see things as well, you trip over things. And then just the whole non-specific, you got to remember that especially diabetics have caused nerve damage with their hyperglycemia. So they have very kind of blah symptoms for their massive MIs, okay? A hyperglycemic patient I took care of recently, sugar was 900, just felt like crap for 5 days. Weak, fatigue, a little short of breath, massive cardiac event, okay? Excuse me. Okay, so keep those things in mind. Life expectancy as of 2017, on average, 77.9 years. Gender does influence that. Genetics plays a huge part in it, right? So, I mean, luckily, my family tree, my 4 grandparents, 3 of them lived into their late 90s with fairly good quality of life. One of them didn't. He died in his early 60s, but he was a smoker and a heavy drinker and had cancer and had cardiac disease and was diabetic, and that all just caught up to him, okay? The environment in which you live. Do you have access to medical care? Are you warm during the winter? Are you cold during the winter, right? Do you have basic things in life that help keep you healthy? Do you have medications? Do you have clean air, clean water? Okay? Or do you live in a violent area? Okay? And your lifestyle. Do you smoke? Do you drink? Do you take drugs? Do you, etc., etc., etc.? Okay. After, good grief, excuse me. After the age of 30, your body, your organ systems start to fail or lose efficacy at the rate of approximately 1% per year on average. Some are faster, some are slower. Okay? We look at some changes. Senses, the eyes and ears, and pain, and taste and smell, right? We have problems with our vision. We lose peripheral vision. We lose central vision. We have problems with hearing. We don't enjoy food and drink anymore, right? You lose your sense of taste and or smell. As people with COVID can tell you right now, you're not very hungry. You don't enjoy eating, so you tend not to. Neurologically, atrophy. The brain shrinks as we get older. That causes a problem when your brain is this big, and as it shrinks, it pulls on blood vessels and stretches them. So when you fall and have a fairly tame fall, and your head does this, you shear blood vessels and you have head bleeds easier. Okay, with problems with memory and just so impaired proprioception. Where am I in space? That stroke exam. Put your hands up, turn them upside down, hold them, close your eyes and hold them. Proprioception says, I know my hands are this far apart. Not, no, this, okay? Cardiovascular, you name it, blood pressures, ACS, strokes, mesenteric infarction. What the hell is that? That is an infarction, right? A clot in your gut. Causes bowel infarcts, basically. Renal infarctions, kidney, right? Aneurysms and dissections, and irregular heartbeats, and rapid heartbeats, and slow heartbeats, and pacemakers. As we age and we lose muscle mass and muscle tone, it's a little bit harder to take that deep breath. Okay, so you may not be ventilating quite as well as you were before. And if you are more immobile, right? You sit around more, you lay in bed more, you're at more risk for pneumonias. Okay? Gerd, gastroesophageal reflux disease. Right? You have years and years and years of Gerd, which put you at risk for ulcers. Right? As you get older, though, that acid may decline, the digestive enzymes may decline, and therefore you are not digesting and absorbing nutrients the way you should be. Also, because all of this slows down, or you're not eating correctly because nothing tastes good, constipation, which can lead to bowel obstructions. Okay, horrible. But again, not everyone goes through all this, right? These are the things that can happen. Bladder, kidneys, immune system just don't work as well. We end up with toxic levels of our normal medicines in our bloodstream. We retain urine, and we have, especially as guys, right, we have prostates that suddenly become the size of a baseball, and you can't pee because as it swells out, it also swells in. You end up in the ER because you're in excruciating abdominal pain, so they can put a Foley in. Okay? Musculoskeletal. We, especially females, but all males can too, you start to lose some bony structure and some strength in the bones. easier for things to break. Now, all of these things, kind of come with age. Your lifestyle, your environment certainly plays a part in whether you speed that up or not, okay? Clinically, depression is not uncommon for folks. Between just the changes in the brain and the fact that, my poor grandfather lived to be 99 and a half. One of his son died before him. His wife died before him. All of his friends and family otherwise died before him. He had, my mom, my aunt, and my uncle. Uncle died, but all his friends were gone. His brothers all died before him. And it depressed him. He did not want to be there, after my uncle died. So you can see that. He was in his mid-90s when they moved into town. He grew up and lived on this piece of property his whole life. His parents had built the house he grew up in, gave him the land next to it. He built their house there in the 40s, raised all his kids. He grew up there. In his mid-90s, they moved into an elderly apartment building in town. And while that was significantly easier on both of them, I don't really think he did well with it. High blood pressure, common. Dysrhythmias, atrial fibrillation, probably the most common one, which puts you at risk for clots, which puts you at risk for stroke and MIs, and et cetera, et cetera. We lose structures in our mouth, right? You start to lose teeth, it starts to get tough to eat. Some people do, and some people don't get dentures. Some people fight with their dentures. Liver's not working, so things build up in your systems, right? You have trouble swallowing, and you end up with some malnutrition going on for all of these reasons, including the small intestine not working the way it should. The small intestine absorbs nutrients. Osteoporosis, osteoarthritis, weakening, the osteoporosis, weakening, osteoarthritis, the pain in the joints, swollen joints, fingers, toes, knees, hips, shoulders, elbows not working well. As you weaken in your musculoskeletal system, you don't cough as well. Coughing moves junk, right? Mucus is in your airways to collect junk. You have trouble coughing that junk up, okay? So you have more risk of infection. You also have less ventilatory changes as far as oxygen, carbon dioxide, heat, water, okay? Renal system starts to fail, you have drug toxicity, and everything just doesn't work as well. Skin, you sweat less. Oh, so perspiration is key in cooling the body off, okay? The skin gets thinner, right? You see a lot of elderly folks with lots of bruising and lots of just nasty little skin tears. We call it onion skin. It's super thin. It's like, a super thin layer of onion skin. You can kind of see through it, and it just gouges easy. And their immune system works a little differently. It doesn't fight infection as well, and when it does, a lot of times they won't run a fever. So you kind of miss the fact that they have an infection. Vision issues, hearing issues, don't forget that because somebody is legally blind or completely blind, they are not deaf. Please don't scream at them. Ugh. Every freaking day you get older, after about 35, it gets harder to lose weight, right? So a little bit more weight you have on, and the longer you have it on, the more likely you are to have type 2 diabetes. And of course, the older you are, more risk of cancer. Late 40s to early 50s for menopause in women. Some of the hormones that they lose at that point have been helping them fight heart disease. Okay. Now, women also have atypical symptoms. So a female in her late 40s, early 50s typically will not have your classic chest pain, short of breath. They'll have flu-like symptoms. They just won't feel good. They'll be a little short of breath. Okay, any of those complaints on a female, middle-aged and older, you gotta do EKGs on. Okay, skin gets paler. They lose some of the elasticity in the connective tissue. Connective tissue helps anchor things like skin, helps anchor bone to bone, muscle to bone. Right? It also helps act as a cushion. Okay? So we start to lose that. And I've already mentioned the fact that the muscles get weaker. When the bones weaken, it doesn't take a lot to break them. Before all of these postmenopausal calcium supplements that you see out there now, the prescription strength ones, we used to see a lot of women. They'd be standing in their kitchen at the sink, and they'd turn to go to the refrigerator, and just that turning, they'd snap a hip. Pathological fractures. Okay? The heart has to work harder because it's pumping against harder vessels, and vessels that are partially plugged with plaques and fats and all that, right? Chest wall, less compliant, right? We've already talked about that. Sense and smell, we've talked about. They're still making insulin, but less efficiently, and they become more resistant to the insulin, and we end up with less glucose being metabolized, which leads to hyperglycemia and weight gain. Right? As the liver starts to fail, we don't filter and excrete things quite as well. Talked about the proprioception, about reaction time, right? The last thing you want is to be driving downtown and have a 5-year-old kid run out in front of you and be slow getting to the gas pedal, getting from the gas pedal to the brake. Reaction time, you're gonna fall. Reaction time is, I'm gonna put my hands out and catch myself before I fall. If you don't have that reaction time, you go face first down that 2 steps into the kitchen floor. Diabetes is a vascular disease. It affects the vascular system. High cholesterol affects the vascular system. Okay, so you can see where things like dementia are at risk, as well as other inflammatory processes. Now, pain perception may decrease, which sounds like a good idea. Ooh, things won't hurt as much. But then again, if things don't hurt as much, it's hard to pinpoint when something's going wrong with them. Poverty line. As we age, the numbers of people living in poverty climb. You know, I read a study a few years ago that said, if you are 65 years old today and you retire tomorrow, you are still going to need about 90% of what you are making before you retired to live the same life that you were. And a lot of people don't. I mean, I'm working on it, but a lot of people don't have that, you know. And so their insurance isn't as good. Their benefits at, you know, whatever they were doing at work weren't as good, and now they're on more medications, and these medications are more expensive, and they have to start making choices between, geez, do I eat a bologna and cheese sandwich tomorrow, or do I take my medicine? You know, it's pretty ugly. Depending on where you live, there may not be a lot of social support, right? And there may not be a lot of financial support to help people out either. You know, some towns have great elderly apartment buildings, and they take whatever money, you know, they budget it based on what the Social Security index says, you know. In other places, there isn't any. And like right now, this is, you know, January 1st, 2022. Happy New Year's, by the way. The housing market's been insane for a year and a half because of COVID, right? People wanting to move out of the city, away from crowded places, into home, and just how home prices have skyrocketed, rents, you can't find places anymore. So it's kind of tough. They can't drive because their reaction times are bad, or they're blind, or they're whatever. They got to rely on people. They lose their independence. Everybody around them's dead, right? They don't have anybody to talk to. And then the money, kind of bad. They've moved out of their family house that they grew up in, or their kids grew up in, right? So like at my house now, I walk around a corner in the house and I can remember something that happened there when my kids were little. I don't want to move out of this house, because I don't want to go somewhere and have zero connections, zero memories, things to connect me to my past. That suck. So elder abuse. Typically, they're older, female. They're dependent on others for either physical or financial requirements. They don't get around as well. They're incontinent to urine and or feces, so they need to be changed a lot and cleaned up a lot. They don't remember things. They may be angry because of dementia. The dementia affects them that way. So they're verbally aggressive. They don't sleep well. They're up all night. They sleep all day, or they don't sleep at all. And they have a ton of medical problems. So the people who are caring for them, besides this being a full-time job, they have other things going on in life, and they get frustrated. And so it could be a family member, but it also could be somebody else, who they're trusting to help them with this. I've taken care of infants who are abused by their babysitters, much less their parents. So it could be anybody. Depression and suicide. The most successful age group for suicide are elderly males. You're a 75-year-old guy. You really don't give a rat's ass about an open coffin or not. Yeah, hey, whatever, leave it open. And they blow their heads off. They have access to and or are comfortable with firearms. And they don't care, right? And this sounds sexist, but females, historically, if they even joke about shooting themselves, that's a bad sign, right? Because they worry about what I'm going to look like in the coffin. I want my friends to be able to see me, my family. I've got my dress picked out, whatever, my outfit. And it sounds sexist, but it is the truth, okay? But old guys are like, no, I just shoot myself, who cares? And they do it. Now, I brought up, in the slideshows, talked about all these bad things and all these risk factors and all the health issues. But really, truthfully, most older folks live on their own, right? They live with a husband, a wife, or a friend, or a son and daughter, but they don't, they come and they go and they do what they want, and they take care of themselves, and good for them. So scene size up is the same. What do I see, hear, and smell as I walk up? Do I see, hear, or smell anything that leads me to think there's been some violence, that there's a risk factor that I need to leave? Is there anything that makes me think they're being hurt? Okay. How many patients, right? Well, right now, we're going into the second winter of COVID here, and in EMS, we are respond for an elderly couple with flu-like symptoms. And we go, oh, it's the Rona. Maybe it's the CO, right? Maybe it's their furnace, okay? Keep the other things in mind, okay? Figure out what's making them sick, their nature of illness, what their mechanism of injury is, what is their chief complaint. And from the door, my general impression, right? I'm walking up and I'm looking at them across the room and I'm like, oh, they look pretty good, right? They're sitting upright, they're pink, right? They're talking to each other. They're looking at me when I walk in the door. They're in no obvious distress. Hey, they look pretty good. Versus, oh shit, because he's blue and tripoding, and you can hear wheezing at the door. Okay. Look around. Does it look like they sleep in their chair? Does it look like they live in their chair? Does it look like they're not eating because there's half-eaten sandwiches all over the place and they're dried, dried and crusty, right? They have piles of medicines laying around them, okay? How are they at getting around? All is well and great when you have a protocol like in Massachusetts that says you cannot walk patients. And you have ambulance services who freak out about walking patients and go, if you walk a patient, we'll fire you. Yes, I've worked for services like that. When really, I'd like you to get up. If it's safe, I'd like you to stand up and walk 6, 8, 10 feet to my stretcher so I can see how you are able to ambulate, right? Are you able to get around on your own? If not, then I'm going to talk to the hospital about that. And maybe we're going to get social services involved, okay? What is their chief complaint? Always communicate directly with the patient first. A lot of folks will turn and talk with the daughter or the son or the grandson, and it's rude, right? Don't assume the patient can't tell you what's going on. This single specific chief complaint can be difficult. They want to tell you, especially if they're lonely, they want to tell you about everything. And I've seen other people, no, why did you call the ambulance today? We'll get there, okay? Don't assume that their mental status is altered because they're old. It's not normal. Something is causing it. You got a family member that can tell you, oh, he's got dementia. Okay, and this is normal? Okay, that's cool. But otherwise, assume it's something else. What is their baseline, right? How does this alter from that? ABCs are the same, right? Airway, breathing, circulation, bleeding. What's going to kill them first? If they look like they're dead and they're not responsive, then it's CAB, right? Compressions, airway, breathing. Start CPR immediately, unwitnessed. Do your ABCs. Remember also when you're dealing with the A that teeth, lack of teeth, dentures, looseness of dentures plays a big part in whether you can maintain a good mask seal, right? And then kyphosis, curvature of the spine. Don't try to, somebody's hunched over like this. Don't try to straighten them out on a board or a stretcher. Prop them up, cushion them so that they're comfortable, okay? Jaw thrust, modified jaw thrust, head tilt, chin lift, okay, whatever's appropriate. If they're like this, then you gotta make sure you get some pillows under their head. And the rest of it's the same, right? Is their airway open? Yes or no? Will it stay open? Yes or no? Are they breathing? Yes or no? Is it adequate? Yes or no? Will it stay adequate? Yes or no, right? This isn't rocket science. There's no difference in that than anyone else. Now, atrial fibrillation, irregular heartbeat, super common in the elderly. The problem with that, when you feel it, you kind of, you're getting, that's what you're feeling. The problem is when you have that space, that's the risk factor for clots. Right? You get blood in behind a valve in the heart, and it's a little eddy. It's just kind of whirling around there. And then it's, so every time it kind of pauses behind that valve, it can thicken a little bit. It goes out through the system, comes back, gets behind a valve, thickens a little bit until, now forms a clot and gets lodged on a piece of broken plaque in a blood vessel somewhere. Okay. As far as irregular pulse being associated with hypoperfusion, super fast, super slow, certainly. Most AFibs, they perfuse just fine. Control bleeding, same way with everybody, right? Direct pressure, if it doesn't work, hemostatics and tourniquets. And then decide where they got to go and how I'm going to get them there. Now, Some pretty common complaints: belly pain. Cardiac gives you abdominal pain, right? So the belly and the chest go together. Anything from about here to here, do an EKG, okay? It could be acute coronary, could be the aneurysm. So bowel infarct or obstruction, right? Last oral intake. Well, how about we add in there, when was the last time you went to the bathroom? Okay. They could have gastroenteritis, right? Inflammation of the stomach or intestines. They could have bleeding in there. And pneumonia can give you belly pain. You think about your diaphragm sits here, way back down in here is part of your lower lobe. You could have pneumonia in here, and you can have radiating pain into the belly. All right. We already talked about some of these things. What's the difference though between dementia and delirium? Right? Delirium is an acute onset. Dementia is a chronic event. So dementia could be Parkinson's. It could be from a stroke that you had in the past. Delirium could be hypoglycemia. It could be a drug overdose. It could be liver failure, diabetic emergencies, shock, hypo and hyperthermia. Remember, their thermogenesis capabilities are significantly diminished. And they could be hypoxic. Infection. The #1 cause of altered mental status in the elderly female is a urinary tract infection. Okay. Meds. Remember, if the liver and kidneys aren't working well, the levels can continue to climb as they take the medicine the normal way. It doesn't have to be an overdose. Seizures, stroke, coma, death, right? Substance abuse. Old people drink, young people drink. There's no difference. Recreational drugs, no difference, okay? And fall and hit their head, TBIs. Get punched, get shaken, right? Shortness of breath, your coronary syndrome. Anemia, if you don't have the oxygen carrying capacity in red blood cells, you feel like you're short of breath. And then the regular, the asthma, COPDs, heart failures, pneumonias, cancers, pneumos, pulmonary embolus. Chest pains, coronary syndrome, hiatal hernia. So where your esophagus comes down into your stomach is a sphincter called the coronary sphincter, cardiac sphincter, sorry, because it's the one, there's two of them. One's a pyloric and one's a cardiac, and the cardiac one's the one closest to your heart, hence cardiac. But if that is torn a little or stretched a little, it allows the top part of the stomach to kind of herniate up into that space. A lot of pain and discomfort. Pneumonia, you got a pocket of pus somewhere where it doesn't belong. It's displacing tissue. It hurts. PEs. Syncope. Now, syncope, near syncope, people go, oh, geez, it's just near syncope. Yeah, I've read studies that say that syncope is roughly 90% cardiovascular in nature. So let's look at this list. Acute coronary syndrome, that's cardiac. Cardiac dysrhythmias, tachycardic, bradycardic. That makes sense. Medications that slow your heart rate down too much or keep your heart from beating hard enough. And vasovagal, right? You're on the toilet, you're constipated, and you're pushing, and that pressure in your carotid artery spikes, and the brain goes, whoa! All the baroreceptors in your carotid arteries go, whoa, 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 whoa! We gotta ease this down. We gotta protect the brain. Blood vessels go, whoop, and blood pressure falls, and down you go. Those are all cardiovascular. Weak fatigue, all of those, right? Dehydration, electrolyte imbalances, infections. Okay. Secondary assessment, same as with everybody. If they're a trauma patient, head to toe, trauma exam. If they're unresponsive, head to toe, trauma exam. Otherwise, focused assessments, right? They slipped on the ice, they got a broken hip. Well, look at their abdomen, look at their pelvis, look at their hip, look at their leg. If they slipped on the ice, they have a broken ankle, from the hip to the toes. They slipped in the kitchen and they got a deformed wrist, shoulder to fingers, okay? Focused exam. You're having chest pain, chest, belly, focused exam. You don't need to do a trauma exam. Okay. Now, remember AVPU, right? Alert, alert and oriented. responsive to verbal stimuli, responsive to painful stimuli, or unresponsive. Mini mental state exam. You need it's a multiple sheet of paper thing, and it's a checklist, and you need to go. Nobody I know is doing that as far as EMS goes. Introduce yourself. Oh God, and my pet peeve: don't call people chief, ma'am, buddy, bud, honey, sweetie. Right? Be respectful, sir, ma'am. What do you like to be called? Joanne. Okay, Joanne. Right? So let's speak slowly, speak clearly, introduce yourself. If they're having vision problems, find out what or how bad it is. So like if they say, you know, my mom's blind. Okay, how blind? Right? Well, she's legally blind. Can she, ma'am, can you see me? Well, I see a shape or a shadow. Okay, great. I know what to do now, right? I'm going to stay in front of her where she can see me. Before I touch her, I'm going to tell her what I'm going to do. I'm not just going to grab her arm and put a blood pressure cuff on it. It's going to scare the shit out of her, right? If they're answering questions slowly, you need to slow down, okay? The other thing is you need to pay attention to what they say and not ask them the same question 10 times. Confabulation. They unknowingly fill in gaps in memory with information that seems to fit. So they're talking about a subject and there's pauses and they just kind of throw extra stuff into it and the family's going, oh, that's not what happened. Okay? You can get history from family and friends, but talk to the patients first. And don't forget sample history and history of the present illness. Okay? Medication history. Find out what they're on. Find out if they're taking them and being compliant with them, and if not, why? Is it financial? Is it just memory? Polypharmacy is multiple medications and from multiple pharmacies, right? When I was a kid, you know, growing up in the 60s and 70s, there was like one pharmacy in town in Rochester. Everybody went there. He knew everyone. And if you had two medications that overlapped, he could tell you that. But now you're getting medications at Walmart because of the $4 list. You're getting stuff at Walgreens because it's cheaper there. You're getting stuff at mail order because we run into that problem a lot, okay? Now, vital signs, basically what you expect with other adults, okay? But don't forget that they have trouble compensating, so they may have normal vital signs and still be pretty sick because of things like their blood pressure meds, okay? Critical patients, rapid exam, chief complaint, and medical history is appropriate, then you can do a focused exam. They have trouble staying warm. Don't strip, you know, we want to strip certainly our trauma patients. But you've got grandma in the house who has a swollen ankle, right? Her ankles are swollen, that's why they called. We need to do vital signs, sure, but taking off all 4 of her sweaters and then not making sure we replace them somehow, whether it be with her sweater or with blankets, we're going to make her cold, okay? Try not to cut clothes. They may not be able to afford them, okay? Limited range of motion. So like, whereas I've got pretty good range of motion in the shoulder, you know, and you're going to pull my t-shirt off over my head, you might hurt somebody doing that. Don't pull on their arms, right? If you're going to lift somebody up, have your partner at the knees, you come in under their arms and hook their wrists, right? And then come up. I know of a crew that lifted this lady up by her arms and broke her humerus doing it, okay? Cloudy pupils, cataracts. A lot of padding underneath the neck and head, sitting her up a little bit, good position with that whole curvature of the spine. Now, secondary assessments. Be gentle, be alert to how they respond as you do things. Also keep in mind that if they can't see things, you got to tell them before you just go reaching, okay? And be gentle with neck and spinal positioning. Breath sounds may be hard to hear because they're not taking big deep breaths. So I always have them turn their head so they're not breathing right in my face, and take as deep a breath as they can. I'll have them do that 3 or 4 times, and I try to piece together one good breath sound, okay? Wheezes, bronchospasm, rhonchi, mucus, crackles, CHF. Okay? Look at their ankles and legs for swelling, which could be their heart, their kidneys, or their liver. Oh, excuse me. Pain, they don't feel it as much. We already talked about that. They may not have fevers. They may be on multiple drugs that do the same thing, and therefore the synergy of that reaction is worse, right? 1 + 1 = 2. But if you have one beta blocker and a second beta blocker, that's equal to 3 or 4 beta blockers. Okay? Treatment. Treat them just the same as you would anybody else, right? If they need an EpiPen for an allergic reaction, you give them the EpiPen. Well, it's bad for their heart. No, hypoxia is bad for their heart. Your EpiPen's just a little bit of a jolt, okay? Not a big deal. IVs, sure. You don't have to hang an IV bag on everybody you start a line on, right? You're starting an IV because, well, I can and I want to, but it fits. The patient's a little short of breath. You know, we're going to give them a nebulizer with some albuterol and Atrovent in it. I'll throw an IV in just to be safe, right? Okay, cool. You don't have to give them IV fluids. It is easy to overload these folks and put them into congestive failure. Reassessments every 5 or 15 minutes, right? Critical 5, stable 15. Be respectful. I've taken care of a lot of patients who have done some pretty amazing things. They've fought for this country. They have a lady I took care of, her son-in-law was Eddie Rickenbacker. Her father-in-law, I'm sorry, was Eddie Rickenbacker. Eddie Rickenbacker was the leading ace for the United States during World War I. He shot down the most German airplanes of any American. That's pretty amazing, right? Guys who fought on all kinds of battlefields all around the world. People who worked for the FAA and investigated things that were like Russians shot down a South Korean airliner back in the 80s, killed like 300 people on it. This guy was the lead FAA investigator, right? Even if they didn't do anything special like that, they still deserve respect. Be respectful of them, okay? Make eye contact, be empathetic. Don't say, oh, I know what you're going through. You don't. You may have gone through something similar, but it doesn't mean you know how they feel, okay? Keep them warm, protect them from the elements. Remember that under respiratory stuff, right? Anemia, low red blood cell count, could be a GI bleed. Asthmatics, our COPDers, congestive heart failures, cancers, all of these things, okay? Pneumonia very commonly causes death in these folks. Excuse me. Fever, chills, chest pain. A little bit of tachypnea, right? 12 to 20 is normal. They're breathing 24 a minute. They got a little bit of chest pain on the right side, and they've had fever and chills for a couple of days. Most pneumonias are not do not have productive cough. Bronchitises do, though, right? Altered mental status and ABCs. We want to keep their SATs at 95 or higher. If they're an emphysema patient on oxygen, 92 to 95 is probably better. Sudden PE, so they throw a clot, right? They're coming home from Florida, right? They're a snowbird. Every October they go to Florida, they drive down together, and every April they drive home together. And so they've been in the car the better part of 3 days, and their calf has been kind of sore. Well, now today they wake up and they've got chest pain or they can't breathe. Okay, that clot, and they've got AFib, right? That clot moved from their leg, broke off, moved up into their lungs, and boom, they can't breathe and they die. Okay, so assess, right? Cardiac, right? ABCs. Pulmonary edema is that left-sided heart failure, and it backs up in the lungs. CPAP, wonderful, wonderful device for this, and nitroglycerin. So if you happen to be in a state like New Hampshire where for CHF you can do nitro, that would be good. Here's the problem though, you give them one nitro and then you put CPAP on them. Every time you want to give them nitro, you got to break the seal on that mask, and that can be a little problematic. Okay, if they are in respiratory failure, then you need to bag them. Anytime they're short of breath, keep them sitting up. They're not going to want to lay down. You may have to bag them sitting up. Acute coronary syndrome can be your hypertensive crises, your heart failures. So cardiogenic shock, so any form of shock caused by pump failure, okay, which could be an MI. Their dysrhythmias, their aneurysms. Syncope, very common in these folks, and silent MIs. Remember I said women especially don't always have typical presentations. Diabetics very rarely have typical presentations. So diabetic female, very atypical symptom. Some of the things you expect to see though with an MI, epigastric or upper abdominal pain is very common instead of chest pain. Weakness, short of breath, fatigue, syncope. They feel faint. They're confused. You got to think MI. SATs, 95 or higher, right? Nitro and aspirin according to protocols. So, one aspirin every 5 minutes, as long as the blood pressure stays over, I think it's 140, or 100 for chest pain, 140 for, I think that's it. Start a line, sure, do a line en route, that'd be fine. Don't forget their aspirin. And don't forget to ask them before you give them nitro whether they take erectile dysfunction meds, because that's another synergistic event, right? 1 + 1 = 2. Well, 1 nitro plus 1 nitro equals 2 nitros. 1 nitro plus 1 Cialis equals 5 nitros. It'll kill them. Their blood pressure will plummet and you will not be able to get it back up. As far as aneurysms, probably the most common symptom is what they describe as a tearing or knifing sensation from their front to their back. Could be in the belly, could be in the chest. Check pulses. You should be doing this on everybody, but circulation, sensation, and motion in all extremities. Are my pulses in my right arm and my left arm the same? Are they the same in my feet? Because depending on where that aneurysm is, could block blood flow to a limb. Okay? Signs of hypoperfusion, right? The pale, a little tachycardic, a little tachypnic. You gotta start thinking shock. Neurologically, any number of reasons, right? Sugar, oxygen, perfusion, temperature, poisonings, overdoses, trauma, strokes, right? So you got to try to think about what's causing it and rule it out. And if you're not sure, right, you got somebody who's confused, not answering questions appropriately, not following commands. If their blood sugar is okay, you got to call a stroke alert, just to be safe. That gets them into CAT scan first, and hopefully we can rule that out early. Difference between stroke and a TIA. TIA is often called a mini stroke. It looks like, smells like, acts just like a stroke, but it goes away on its own within a short period of time. Typically, they say less than 24 hours. Okay. Seizures and dementia. Now, Cincinnati stroke scale. All right. Smile, facial symmetry. Stick your hands out, turn them upside down, close your eyes. Drives proprioception, all right, spatial orientation. And you can't teach an old dog new tricks. That's the most common one, Cincinnati. Definitive care facility, closest appropriate. Can they do stroke care there? And give them a heads up. Hey, I got a stroke alert for you, okay? Now, seizures. I've read studies that say everybody will have one seizure at some point in their life. And like 60% of the time, we don't know why. It's just, it's God's will, right? But seizures, first thing, right? Check a pulse. Because a lot of patients in VFib will look like they're seizing. They'll be twitching a little bit. So VFib, think about strokes, and think before that, blood sugar as well. Empty bottles around, could be withdrawal. Dizziness, could be a stroke. Ooh, so think about doing a lift assist. Ladies on the floor, no, I just need a little help getting up. Well, what happened, man? Did you trip and fall? No, I just got a little dizzy for a minute. Or, oh, I just lost my balance. Okay, Meniere's inner ear disease. Delirium is that chronic event going on with something like dementia, Parkinson's. I'm sorry, dementia, long-term, something like, right, Parkinson's, dementia, Alzheimer's. Delirium is an acute event. That could be your stroke, your overdose, your hypoxic event. Urinary tract problems. So for males, retention. Incontinence, especially for females, is not uncommon. And so now you have a warm, wet environment that's now full of urine and stale old urine, right? Because maybe they don't clean themselves very well either. A lot higher risk for infection. Retention increases risk for infection. And part of why, the incontinence is that they're weaker, and all parts of them are weaker. Gastrointestinal, the whole renal, the whole urinary system, okay? They can't get around very well, so they just wet themselves. That's very common. Nausea, vomiting, diarrhea, constipation, super common because of many of the medicines they're on. Also because maybe for either medication reasons or mobility reasons, they don't drink a lot. Therefore, they tend to run dehydrated. Constipation can certainly lead to bowel obstructions, which can cause pain. It doesn't matter what's causing the pain. Abdominal pain is a life-threatening event. You have to think of it that way with these folks, okay? GI bleeding is super common. They don't even know they've got it. They come in, they've been weak and dizzy for a few days, maybe getting worse over a week. They get up, they walk to the refrigerator, they get a little short of breath. Well, it turns out that they've had this little slow GI bleed. Their stools have been normal looking to them, but when we take a stool sample, it comes back positive for blood. Pretty common. Diabetes, if they have type 2, it certainly gets worse as they get older. Very common cause of altered mental status. Hyper and hypothyroidism. Kind of not something that we're most likely to pick up on. Now, surgeries, infections, illnesses certainly can increase diabetic problems, and you could end up with hyperglycemia, whether it's type 2 with HHNC or type 1 with DKA. Infectious diseases, super common, especially in nursing homes where people are less mobile and cramped together in small areas. So the pneumonias, the flus, super common. Sepsis and herpes, yeah, they happen too. Like I said, with females, the number one cause is of altered mental status, a UTI. You got to think about it, okay? Males don't generally get UTIs. We're built different. If you're not aware of how, I recommend you Google that later. Males shake it a couple of times to dry, right? Our urethra is longer, and it stays, for the most part, typically it's easier to clean, so it's cleaner. Females' urinary meatus is only, about yay far from their bladder, and it's in a warm, wet environment. Bacteria like that environment, so it's easy for bacteria to get up that little space as opposed to that bigger space. Okay. Males, however, especially males, typically males with Foley catheters, because of their prostate, so they end up with Foley's in, and that is a tube direct into the bladder, and so it's easier to introduce bacteria, and so they do end up with UTIs. Musculoskeletal pain, pretty common. Weakened bones, the osteos, right? Best way to splint a hip fracture in elderly: pillows for padding and support and a scoop stretcher. I disagree. The way I like to do it is with a KED board. You take the KED board, that short vest type immobilization device, you turn it upside down and you put it beside them so that the head goes around the knees with the head straps, and the waist goes around the pelvis, and you can snug it down nicely, and it works really, really well. Okay. Arthritis. So arthritis is an immune system failure, and the immune system is attacking joints and causing swelling and pain. Vertebral problems, right? You can have degeneration, you can have curvatures. You got to be careful of that. Hematologic, so blood disorders, cancers, and lack of carrying capacity and clotting problems. That anemic patient, as I've said before, kind of weak, tired, short of breath on exertion, a little pale, a little cool to the touch. Right? Coagulopathies, which are dysfunctional clotting issues. Certainly immobile people, circulatory problems, septic patients, all are at risk for coagulopathies. And a lot of problems stem from the medications. Now, they can certainly have underlying psychiatric illness, right? For every 25-year-old with depression, anxiety, manic depression, etc., with luck, they're going to continue to get older, and they're still going to have those problems, okay? But you got to think about the other things that are going on. That could be an acute event: your sugars, oxygens, infections. What is their normal baseline and normal mental status? Like, are the lights on but nobody's home? Are they completely oriented normally? Or, for the last 6 months, he just kind of has been going downhill to where he is now, okay? People can harm themselves, whether they mean to or not. The voices said to, whatever, okay? So just be aware of that and be ready to restrain them if necessary. Now, within the blood, because of, liver and kidney issues, you can end up with all kinds of different chemical issues, whether it be increased plasma levels, drug levels building up. But don't forget, they can also intentionally try to kill themselves by taking too many drugs. Look at the pill bottles, look at the dates. Is it appropriate? How many are missing? Is that appropriate? Well, they've had 90 pills now for 30 days, and they take it twice a day, and hey, everything looks okay, right? We've got enough. All right. Shock. This slideshow beats us to death, but it's important, right? Look for signs, be suspicious, right? Sepsis will cause shock. Cardiac failure will cause shock. Bleeding, dehydration will cause shock. Okay. ABCs, IVs, ringers or saline, depending on what you carry, and boluses of 250 to 500, checking vitals and lung sounds in between. It's easy to break people, older people. Be gentle with them, pad them. Make sure the collar does not slip up on their face and hurt their nose, right? Just all kinds of stuff that you don't think about. The skin is very thin, so they have temperature issues, and it's easier to burn themselves because the skin's thin, so it doesn't take as long. And they may not realize they're being burned. They may not be able to move because they're wheelchair bound, right? Fluids, same thing, 250 to 500. Make sure we're not overloading them, and keep them warm and keep them covered for the ride. Environmentally, we've already talked about the fact that they do not create heat very well. They do not shed heat very well, and so they stay too hot or they stay cold, and it's pretty common. Especially in today's day and age with COVID, we should all have thermometers in our trucks anyways. Take a frickin' temperature. All right, so that is chapter 45 of the AEMT book on geriatrics. This book goes a little more into a little more detail than the EMT version, which again is chapter 34. They both do a good job. Sometimes one chapter does a little better than the other. But anyways, I hope you got something out of this, and I will see you guys in the next video.